بسم الله الرحمن الرحيم. ان شاء الله هنتكلم دلوقتي على anatomy of thyroid and pituitary gland. Thyroid gland, one of the endocrine gland, secreting thyroxine hormone, located in the lower part of the front of the neck. This gland butterfly in shape. Size varies in size, become more large in female than male. Extension extends from C5 to T1 behind and from the middle of the thyroid cartilage to the fifth tracheal ring in front. Fascia of thyroid gland. The gland covered by two capsules. True capsule, which is formed by condensation of the connective tissue of the gland, and false capsule, which is sheath of the pretracheal fascia. Pretracheal fascia is a layer of deep cervical fascia. Pretracheal fascia, which surround thyroid gland, extends from the hyoid bone to the fibrous pericardium below. These fascia become more dense anteriorly, so thyroid enlargement often occur posteriorly and may compress trachea, leading to hoarseness of the voice, to compress esophagus, causing difficulty in swallowing. Division of thyroid gland. Thyroid gland divided into right lobe, left lobe. The lower part of the two lobe connected with the isthmus. At the upper border of the isthmus there is another small lobe called pyramidal lobe. Relation of the thyroid gland lobe. Each lobe is conical in shape, has an apex directed upward, base directed downward, two borders, anterior border and posterior border, three surfaces. This transverse section is the level of the thyroid gland. Thyroid lobe has three surfaces. This surface called lateral surface, and that which is directed towards trachea and esophagus called medial surface, and the last facing the carotid sheath called posterior surface. The apex of the thyroid lobe is directed upward at the level of the oblique line of the thyroid cartilage, related to bifurcation of the superior thyroid artery. Base is directed downward, related to the fifth tracheal ring. Anterior border of the lobe is thin and sharp, related to the anterior branch of the superior thyroid artery. The posterior border, which is rounded and separating the middle and the posterior surface, related to posterior division of the superior thyroid artery, inferior thyroid artery, and parathyroid gland. Relation of superficial or lateral surface. This surface is related to four muscles. First muscle called superior peri of omohyoid, and the second muscle called sternohyoid muscle. This muscle originated from the sternum and become inserted into hyoid bone. Deep to the sternohyoid muscle there is another muscle called sternothyroid muscle. This muscle originated from the sternum and they become inserted into the oblique line of thyroid cartilage. Lateral to this muscle there is another muscle called sternomastoid muscle. This muscle originated from both sternum and the clavicle and inserted into the mastoid process and superior nuchal line of the skull. Relation of the medial surface. Relation of the medial surface divided into upper part and lower part. Upper part is related anteriorly to the larynx and posteriorly to the pharynx. Between larynx and the pharynx there is the external laryngeal nerve, and the lower part of the medial surface is related anteriorly to the trachea, which is continuation of the larynx, posteriorly to the esophagus, which is the continuation of the pharynx. Between both trachea and the esophagus there is recurrent laryngeal nerve. Relation of the posterior surface. This surface is related to the carotid sheath. Carotid sheath layer of the deep cervical fascia, enclosing a neurovascular bundle, extended from the base of the skull above to the arch of the aorta below. Content of this sheath is internal carotid artery medially, internal jugular vein laterally, and in between the vagus nerve. This sheath separated the lobe from the prevertebral muscle. Relation of the isthmus of the thyroid gland. Isthmus of the thyroid gland has two surfaces and two borders. Anterior surface is related to skin and fascia, sternothyroid and sternohyoid muscle, lastly to the anterior jugular veins. Posterior surface of the isthmus is related to second, third, and fourth tracheal rings. Upper border of the isthmus is related to an anastomotic branch between the two superior thyroid arteries. Lower border of the isthmus is related to the inferior thyroid veins, which may be 2 or 3 in number. Pyramidal lobe of the thyroid gland. This pyramidal lobe is a small conical lobe located at the upper border of the isthmus, and that lobe is connected to the hyoid bone by a fibromuscular bundle called levator glanduli thyroidi. This levator glanduli thyroidi is a remnant of the thyroglossal duct, the site of that lobe to the left side of the median plane. Arterial supply of the thyroid gland. Thyroid gland is supplied by 3 arteries. Superior thyroid artery, which is a branch of the external carotid artery. Inferior thyroid artery, which is a branch from the thyrocervical trunk of the subclavian artery. And lastly, the thyroid-ima artery, which may arise either from the arch of the aorta or from brachiocephalic artery. First is the superior thyroid artery. Origin of that artery originated from the external carotid artery. Course of the artery is directed downward and forward, accompanied by the external laryngeal nerve near to its origin. So in case of doing thyroidectomy, it is safe to ligate the artery near to the gland, near the apex of the gland, to avoid injury of the external laryngeal nerve. Termination of this artery terminated at the apex of the thyroid lobe and divided into anterior and posterior branches which run along the anterior and posterior border of the gland. Branches of the superior thyroid artery. This artery gives many branches. First branch called glandular arteries. These glandular arteries supply the upper third of the thyroid lobe and the upper half of the isthmus. Second branch is the superior laryngeal artery. This superior laryngeal artery piercing the thyrohyoid membrane and supplies the upper half of the laryngeal cavity. Third branch is the infrahyoid artery. This infrahyoid artery passing below the hyoid bone and shares the arterial supply of the infrahyoid muscle. Fourth branch is the sternomastoid artery, and that artery supplies the sternomastoid muscle. And the last branch called the cricothyroid artery, which supplies the cricothyroid muscle, which is the muscle of the larynx. Second artery called inferior thyroid artery. This inferior thyroid artery originated from the thyrocervical trunk from the first part of the subclavian artery. Course of this artery directed upward and medially, accompanied by the recurrent laryngeal nerve near to its termination. So in case of doing thyroidectomy, it is safe to ligate the artery away from the gland to avoid injury of the recurrent laryngeal nerve. This nerve becomes related to the posterior border of the gland and then give many branches. Branches of the inferior thyroid artery. First branch called glandular branches or glandular artery, which supplies the lower 2/3 of the thyroid lobe and the lower half of the isthmus. Second branch is ascending cervical artery. This artery becomes related to the scalenus anterior muscle to share in the arterial supply of the spinal cord. Third branch is the inferior laryngeal artery. This artery gives arterial supply to the lower part of the laryngeal cavity. And the last branch called tracheal and esophageal branches share in the arterial supply of both trachea and esophagus. The last artery called thyroid-ima artery. If this artery is present, it may originate either from the arch of the aorta or from the brachiocephalic artery. This artery ascends in front of the trachea and supplies the isthmus. Venous drainage of the thyroid gland. Thyroid gland is drained by 3 veins: superior thyroid vein, middle thyroid vein, and inferior thyroid vein. Superior thyroid vein originated from or emerging from the apex of the gland and ends into the internal laryngeal vein or the common facial vein. The middle thyroid vein emerges from the middle part of the thyroid loop and also ends in the internal jugular vein. Inferior thyroid vein, which emerges from the lower border of the isthmus, ends either in the corresponding brachiocephalic vein or unite together to end into the left brachiocephalic vein. Lymphatic drainage of the thyroid gland. This thyroid gland is drained by 3 groups of lymph nodes. The upper part of the gland is drained into the upper deep cervical lymph node, and the lower part of the loop is drained into lower deep cervical lymph node, while the isthmus is drained into a group of lymph nodes called pretracheal lymph node. This pretracheal lymph node is a group of lymph nodes present in front of the trachea, whilst both upper and lower deep cervical lymph node are a group of lymph nodes related to the internal jugular vein. Enlargement of thyroid gland. Enlargement of thyroid gland is called goiter. The enlarged gland causes a swelling in the neck that may compress the trachea, esophagus, and also the recurrent laryngeal nerve. It may extend downward, result in what's called substernal goiter. Thyroidectomy. In most of the cases, it usually involves excision of a part or most of the thyroid gland, leaving some gland behind. This surgical procedure is usually carried out for benign disease such as multinodular goiter. However, in some thyroid carcinoma, it's also indicated to do thyroidectomy. In case of doing thyroidectomy, there is a possibility for damage some structure, like parathyroid glands, which is related to the posterior border of the gland. Also, the recurrent laryngeal nerve, which is related to the medial surface. Rarely, the nerves of the carotid sheath may be injured, like the vagus nerve, and lastly, also the sympathetic trunk. Injury to the recurrent laryngeal nerve. This recurrent laryngeal nerve is related to the inferior thyroid artery, and its branches near to the base of the gland. So, in case of doing thyroidectomy, the inferior thyroid artery is ligated some distance lateral to the thyroid gland, near its origin, to avoid injury of this nerve. What is the symptoms in case of injury of the recurrent laryngeal nerve? In case of the unilateral recurrent laryngeal nerve injury, this recurrent laryngeal nerve supply all muscles of the larynx except one muscle called the cricothyroid muscle. In case of unilateral injury of this recurrent laryngeal nerve, the vocal cord of this nerve will be in a position called paramedian position, which is the midway between abduction and abduction. This will result in disturbance of phonation, which I mean voice production, with no affection of respiratory process. This will result in an important sign called hoarseness of voice. But in the case of bilateral recurrent laryngeal nerve injury, both vocal cords will become in the paramedian position. This will result into stridor or respiratory distress or pause, with no or little affection of the voice production. What about lesion of the external laryngeal nerve? This external laryngeal nerve is related to the superior thyroid artery near to its origin. To avoid injury of this nerve during thyroidectomy, it is safe to ligate the superior thyroid artery at the superior pole of the gland, where it isn't not as closely related to the nerve, away from its origin. In case of the injury of the external laryngeal nerve, this will result into loss of a muscle called cricothyroid muscle, which is responsible for changing in the size, in the length and the tension of the focal folds. This will lead to loss of what's called high-pitched sounds, because the paralyzed cricothyroid muscle supplied by this nerve, and this will become unable to vary the length and tension of vocal cords. Second part is pituitary gland. Definition of the pituitary gland is a small endocrine gland lies at the base of the brain in a depression called hypophyseal fossa or sella turcica of the skull. This part of the sella turcica is a depression in the body of the sphenoid bone present in the middle cranial fossa. This gland is oval in shape, about 12 mm in breadth and 8 mm in length. This gland is roofed or covered by a fold of the dura called diaphragma celli. This diaphragma celli has a central halo for passage of the infundibulum of the pituitary gland. This infundibulum makes a connection between the pituitary gland and the hypothalamus. Function of this gland is responsible for maintaining the integrity of other endocrine glands through the hormonal axis. Lobes of pituitary gland. This pituitary gland consists of two lobes, anterior lobe and posterior lobe. This anterior lobe called adenohypophysis. This adenohypophysis, its upper part give a process which passes in front of the infundibulum called pars tubularis, and its lower part is divided by a rudimentary cleft into pars distalis and pars intermedia, which lies behind. The second lobe called the posterior lobe. This small posterior lobe called neurohypophysis. This small lobe sends a neural loop to the hypothalamus, which is passing through the central halo of the diaphragma celli called the infundibulum, which make a connection between both pituitary gland and hypothalamus. Look at this. This is the infundibulum of the pituitary gland, which is the part of the posterior lobe and connects the pituitary gland to the hypothalamus. And this is the anterior lobe of the pituitary gland, which is called the adenohypophysis. This anterior lobe also again sends a tubular process called pars tubularis in front of the infundibulum, and its lower part is divided by a rudimentary cleft into both pars distalis and pars intermedia behind. The posterior lobe, which is called the neurohypophysis, sends an infundibulum which connects also the pituitary to the hypothalamus. Relation of the pituitary gland. Or looking at this section, found on each side of the pituitary gland will find the cavernous sinus and its content. The content which is present in the lateral wall of the cavernous sinus are third, fourth, and parts and some branches of the fifth cranial nerve. On its floor we will find the abducent nerve and the internal carotid artery. Superiorly to the gland is the diaphragma celli, which separates the gland from the optic chiasma. Inferiorly to the gland, the body of sphenoid pore and the collection of air cells called the sphenoidal air sinuses. Anterior to the gland there is the tuberculum celli and the sphenoidal air sinus, which separates the gland from the optic chiasma. Posterior to the gland there is the dorsum celli, which separates it from the bones and the basilar artery. Look at this coronal section at the level of the body of sphenoid bone. Again, superior to the gland there is the diaphragma celli, which separates the gland from the optic chiasm, and on each side there will be the cavernous sinus and its content. Inferior to the gland there is body of sphenoid bone and the sphenoidal air sinuses. Blood supply of the pituitary gland. This gland is supplied by two arteries. The first artery is called superior hypophyseal artery, and the second is called inferior hypophyseal artery. Both arteries are branches of the internal carotid artery. Their venous drainage into the surrounding dural sinuses, which are the cavernous and intracavernous sinuses. function of the thyroid gland, the function of the pituitary gland. This pituitary gland secrete hormone that are essential for both growth and reproduction through its connection with the hypothalamus through hormonal axis. Thank you.